Buenos dias. Bienvenido to Belleza con Dr. Roland. Today I thought it would be interesting for me to talk a little bit about facelift procedures. Since we've done a few shows on these, I wanted to give more of an education, a tutorial, to explain what is done. Everybody's heard the term, but what's actually being done is two parts to the surgery. There's a deep part to the facelift where the muscles underneath are being tightened up, and then the skin is folded into the ear so the scar hides within the ear like this.
Mi nombre es Laura y voy a hacer cambio porque cada vez que yo me veo en el espejo, no me importa la edad, yo sé que tengo mi edad, pero estas cosas aquí, que se van cayendo como un pavo real, no, me sentía muy mal conmigo mismo cada vez que me veo en el espejo. Yo quiero otra vez estar así, yo quiero verme en el espejo y como nacer de nuevo, volver a ser quien yo era, y eso lo puedo lograr con el Dr. Roland.
Most facelifts are combined with neck lifts because as the face ages, so does the neck. The signs you see in a face needing a facelift are these lines getting very deep, extra skin hanging here, and with the neck, of course, we all know when we get extra skin here in the front of the neck. This is one of the longer surgeries that plastic surgeons do. So for that reason, a full medical clearance from your doctor is necessary to make sure that it's the right operation for you.
Ay, doctor, ay, gracias, doctor, Dios me lo bendiga. Ay, qué feliz estoy ahora con este maquillaje. Dios puso en mi camino al Dr. Roland. Yo soy alérgica a la anestesia lidocaine, la cual usaba el Dr. Roland. El Dr. Roland me dijo, yo creo que no te la puedo hacer, pero primero voy a consultar con el anestesista. Y resultó que pudieron usar otra anestesia.
For patients that have medical conditions and cannot do these long procedures, there are smaller facelift procedures which are done under local anesthesia in the office that just remove a little skin from in front of the ear. But if you have the right face for those procedures, that can make a big difference in what you see along the jawline. Just did the in-office facelift on Sharon. As you can see, she had skin that was hanging down here. Now the skin is nice and tight. The surgery finished 5 minutes ago. She already looks great. If you peel this back, all you see is a little bit of swelling. Tomorrow she can go to work. After the surgery, you'll go home with a large dressing wrapped around the head. And that's to keep things nice and tight so that the face doesn't swell too much. Most patients need about a week to 10 days after the facelift before they really start going out very much. The sutures can be hidden behind long hair over that first week. If you have short hair, then most women wear some sort of scarf to hide those sutures until they come in the office to have them removed. Eugenia, no duele, no dolor?
No, nada, doctor.
No?
No,
Everything's
nada.
okay?
Todo ok. Usted me operó. Yo no sentí dolor absolutamente nada en los días que yo me estuve recuperando,
Good.
doctor. Nada.
The muscular feels fuerte when you move your face? Beautiful.
Todo
Good.
bien, doctor.
Now, very often when doing face and neck lifts, there are other surgeries that can be combined. And the most common ones are, of course, the eyes. With the eyes, the extra skin from above the eye is removed with extra fat in the corners and above the eye to give the eye a younger appearance. There is a small scar, very thin scar, that hides in the eyelid. When you close your eyes, you can see it, although it'll be faint, but when you open them, it should almost not be visible at all. The extra fat under the eye is also removed, sometimes with skin and sometimes without, depending on your particular situation.
Estoy contento con la operación que me hicieron. Antes era un viejito, ahora soy un muchachón, un jovencito.
What I very often do at the same time as these procedures is also take some grasa from the patient's abdomen and fill up the cheek and into the crease here to give a more youthful appearance. Look how beautiful she looks. So now she has very natural looking cheeks. We've softened the lines in her face. Her eyes are perfect, and now you can really concentrate on her beautiful eyes, and you don't see the extra skin and fat that she had before the surgery. The other surgery that sometimes is combined with a facelift is a small nose job. And what I mean by small nose job, it may just be the narrowing of the nostrils slightly or a little work in the tip for a tip that sticks out too far. So there is a lot of information about facelift surgery and all of the other surgeries that most often are combined with it. As always, all of the pros and cons of these surgeries can't be discussed in a television segment like this. It needs to be discussed in person, in my office, across from one another, face to face, so I can point out how your face is unique to what we're discussing and how things will be done in your particular case to give you the look that you desire. So as always, I thank you for watching The Jackie Show, and I look forward to seeing you in the office.
Así que todo el que se quiera ver bello y bella, que venga para acá, donde el doctor Roland, que va a estar encantado.